and welcome to my channel. My name is Jazzy RN. If you're new here, welcome. If you're not new here, welcome back. The goal of my channel is to help nurses pivot from the bedside to remote work. Trinity Health is hiring a centralized triage RN. This is a part-time job, 12-hour day shift. The highlights are your first and second week of working here. Day one, benefits, no waiting period. I always go straight to the qualifications. Even if you don't meet every qualification, I still suggest you apply. They want you to be enrolled in a BSN program and complete it within 4 years of hire, valid RN license for the state of Michigan, experience in healthcare setting or enrollment in RN residency, specialty credentialing preferred according to clinical nursing practice, specialty area. Healthmap is hiring an RN care navigator, 100% remote in Illinois. And this is remote for candidates that have an active RN license in Illinois. Requires an RN license, BSN required as well. These 4 bullet points are preferred, not required. No travel. The pay is $77,398 to $115,061. Evry Health is hiring a utilization review RN. This is full-time. You must work within the U.S. Eastern or Central time zones. This job requires you to be an RN in Texas or a compact license, and they want you to include your license number and corresponding state in your resume. 1 to 2 years experience working at a health plan performing utilization management using standard practice guidelines. Working knowledge of basic CPT, ICD-10, authorizations, digital health programs, NCQA or URAC standards, 3 to 5 years clinical experience in a hospital or ambulatory setting. I'm going to pass up these other bullet points. Bonus for these 3 bullet points. I do want to mention this one in particular where it says MCG certification. If you go to the description box below, you'll click on the link, the very top hyperlink. It will take you to Cure the Bedside Burnout. And then from there, you click on, at the very top, you'll see resume tips. A new screen will appear. If you scroll to the very bottom of that page, you'll see where you can go to get MCG certification. There's also another one where you can get intercall certification. So if you want to make your resume more marketable by having MCG certification on there, that's an option. Just an FYI, all the companies I've worked for, the 3 companies, they trained me on interqual and MCG. This position requires work during stated business hours and rotating on-call weekends for utilization review cases, and you must have high-speed internet. Next position is care coordinator RN. This is also with Evry Health, and the job has the exact same requirements. Texas license or compact. Add your license and state to your resume. This one has 3 different bonuses for if you have any experience in a call center, work during the business state hours, rotating on call weekends. And next job is bilingual care coordinator RN for Evry Health. This is also full-time, working in Central or Eastern time zone. Must be fluent in conversational Spanish. And Spanish fluency, Texas license or compact license, include your license number and the state. Bonus for these 2 bullet points. WPS is hiring for a medical review nurse analyst. It is full-time. Salary is $68,000 to $70,000 per year. Pause to read this. These are the states where you can work from home. Associate's or bachelor's degree in nursing, active RN license, 1 or more years of clinical experience, just 1 or more. I'm going to skip these bullet points except for this one. Right here where it says solid computer skills with experience working in multiple online systems. That includes Microsoft, Outlook, Teams, OneNote, Word, Excel. Make sure you add platforms to your resume. That includes not only Microsoft, add Epic, Cerner, Protouch, whatever platform or software you use at your current job or your previous jobs, add this to your resume. This makes your resume more tech savvy. Here are some preferred qualifications. Here are your work requirements. You must be wired in to your internet with your router to your computer high-speed cable or fiber, and they do want you to have a speed test done to make sure you meet the requirements. Orlando Health is hiring an ambulatory nurse triage. This is a day shift job. This is full-time work from home remote. Monday through Friday, 8:30 to 5 p.m., no weekends, and no on-call schedule. Orientation will take up to 3 months, and it will be at a call center downtown Orlando. Must have an RN license and a BSN, and they require you to have a current BLS. I'm not sure why if you're working remotely. Add Epic to your resume if you have it. 3 years clinical experience in a specialty or 5 years covering multiple specialties. But you actually must live within 3 hours of the office for training, meetings, and if there are any issues with your computer, internet, or power, you can come to the office to work. I've had issues with my power. That happens. Like whenever you have an issue with a hurricane coming or a tornado, it does happen. For your internet going down, you can use your phone as a hotspot. That's an option. And for your power going out, let's say just at your home, the power goes out. You can go to your nearest library or FedEx office or have a backup power supply available. Alara Caring is hiring an engaged clinical care specialist LPN in 4 locations: Dallas, Cleveland, Oklahoma, Springfield. Requirements include LVN, LPN, or compact license for all states serviced by Alara Caring, and able to obtain required licensure within 30 days. Reliable transportation for in-office meetings or other reasonable requests to be in office for daily tasks. I would ask about this bullet point during the interview process. Alara is also hiring a medical reviewer, LPN. This is 3 locations: Dallas, Lafayette, Louisiana, and Oklahoma. Current LPN, LVN license, 3 years as an LPN or LVN, and home health or hospice required. Preferred if you have any experience in medical review, that's UR, CM, knowledge of appropriate billing and coding. Advanced computer skills with proven ability to multitask effectively across dual screen environments. Promote your computer skills on your resume. Conduit Health Partners is hiring an RN transfer center specialist. Conduit Health Partners, work at home, any state. Job is available in 2 categories, all shifts remote. On to the qualifications. The hours are subject to change based on needed operations. Active RN license required. Also, active multi-state compact license required. Requires an ADN in nursing. Preferred is BSN. 1 year of acute experience is required. That's a bedside. 3 years of acute experience preferred. Healthcare contact center preferred. If you have Epic or Genesis, add this to your resume. Really upload and download speeds required. And make sure your workspace is a room with a locked door per HIPAA regulations. Although I've never had Care Harmony is hiring a remote LPN. This job is full-time, 100% remote, no face-to-face contact with patients, weekdays, Monday through Friday, no weekends, rotational on-call twice per year on average. Active Illinois license for LPNs. Make sure you focus on your tech savviness, excellent written and verbal communication skills. Add Epic to your resume and bilingual if you have it. Pay is $22 an hour, which is $21 plus $1 an hour Illinois license bump, up to $28 per hour, and you can pick up overtime for increased earnings. Advanced Health is hiring for remote utilization review nurse. This is part-time, 20 hours per week. You'll generally work Monday through Friday. You may include additional hours to meet the needs of the position. And this is remote to strongly Oregon nurses, but if you also live in California, Arizona, Texas, and Florida, salary is $35.29 to $47.37 per hour. Unrestricted RN license in Oregon, experience with similar population in healthcare and health plans or managed care, experience administering OHP, Medicare benefits, or utilization review, highly preferred. And the pay again is $35.29 to $47.37 per hour. Providence has two jobs available: clinical program coordinator RN, case and disease program remote. This one's in Oregon and this one's in Washington, exact same jobs. It is full-time. It is for nurses who are residing in Washington or Oregon. You must be an RN, 5 years of clinical and nursing experience. This bullet point right here adds to your resume: experience working with physicians in the collaboration and management of patient care. Here are the preferred requirements, and the pay for this one is $53.19 to $82.58. Austin Regional Clinic is hiring for an RN OBGYN centralized phone triage, full-time. This job requires you to have an RN of only 1 or more years experience. Preferred if you have any telephone triage experience in ambulatory hospital or home health, and bilingual are bonuses. Also, they want you to be an RN in the state of Texas. And your schedule is the weekdays, 8:30 a.m. to 5:30 p.m. But FYI, training and orientation at our administrative facility, work from home opportunities after 90 days. Must reside in Texas and be willing to attend on-site training and occasional in-person department meetings in Austin, Texas. UMass Memorial Health is hiring an LPN, Advanced Therapeutics. This is full-time. Advanced Therapeutics, this is full-time. It is $28.14 to $41.12 per hour, weekdays from 8 a.m. to 4:30 p.m. Is a part of the union share, which is state healthcare and research employees. And you must be an active RN licensed nurse, 2 years of clinical experience. And if you have Epic, add it to your resume. And just an FYI, make sure that whenever you look at these job descriptions, whatever you do at the bedside that relates to this job description, finesse your resume to the job description. Open Loop is looking for a clinical specialist CMA clinical education. This is for the certified medical assistants with an active certification and strong communicator who can translate technical workflows into a clear, user-friendly guidance, organized and detail-oriented, ability to manage multiple priorities in a fast-paced environment, comfortable navigating evolving systems, tools, and operational processes. Also right here where it says experience supporting onboarding, training, or operational workflows in the healthcare or telehealth environment. For your resume, I would suggest you put, let's say you have to train any coworkers. That could be your support or on onboarding someone and training as this bullet point. If you actually have to train anyone on the job, this is a your time to shine right here. And here's some additional qualifications. You can pause to read here. Next company is MedWatch, hiring a bilingual case manager assistant. This is for LPNs. It is full-time for experienced LPNs. Basic computer skills, but you still want to promote your skills. LPN or medical assistant, nursing assistant certification for this job. 5 years of varied clinical experience preferred, or 3 years in a specialty field. Microsoft Office, put this on your resume. And additional, if you can speak fluent in English and Spanish with strong reading and writing abilities in each language. The pay for this one is $23 to $27 per hour. Case manager assistant LPN, must be an LPN or medical assistant or nursing assistant certification. 5 years varied clinical experience, 3 years specialty, same as the previous job. Go past all this information, and the pay is $23 to $27 per hour. Case manager RN, full-time remote. RN license, BSN preferred, not required. 7 years of varied clinical experience. Pay for this job is $72,000 to $81,000 per year. Case manager RN license in all 50 states. This is a full-time job. A BSN is preferred, not required. Now, being licensed in all 50 states, including non-compact states, MedWatch reimburses for renewals of RN licenses that's outside of primary state of license of residence. And the salary is $72,000 to $81,000 for this job. RN case manager RN level 1 bilingual full-time. A BSN is preferred. Same as the previous job, 7 years very clinical experience. Pay for this job is $72,000 to $81,000 per year. Chronic condition case manager RN. This is also full-time remote. 3 years of clinical experience and 2 years of chronic disease management and patient teaching in any setting preferred. And the pay for this job is $62,000 to $74,000. Evergreen Nephrology is hiring a nurse, care manager, transitions of care. This is remote for all locations. Fully remote, working 8:30 to 5 p.m. Central Time Zone. You must have a associate's degree in nursing and compact license is preferred. 3 years care management, 2 years transitions of care, chronic and complex care management, utilization management experience, and Microsoft Office to your resume. You have home internet with download speeds of 25 megabits per second, upload of 10 megabits per second. Cable, fiber, and DSL connections are hardwired, and the internet device is recommended. This role is $90,000 to $103,000 per year. Personify Health is hiring a case manager nurse RN. This is full-time. Must be an RN with a California license. Multi-state license will also be required, at least 5 years med-surg or acute care, and 2 years in case management or equivalent combination of education and experience. Prior experience in management, prior case management experience, ER, critical care, or other relevant clinical care experience. And the salary is $36 to $38 per hour for Personify. Accenture Health is hiring a clinical reviewer RN remote US. This is full-time. At least 2 years of clinical experience. An RN license in South Carolina or a compact state. BSN preferred. I'm going to skip over these bullet points. You can read at your leisure. And the pay range $28.37 to $39.19 per hour. Wellbox is hiring a remote LPN LVN clinical care coordinator, $22 per hour. Must be an LPN LVN and that it's clear and active in your state of residence. Compact license is required if it's available. At least 2 years of clinical experience. It's a plus to have care coordination or care management, health coaching, and motivational interviewing a plus. Any electronic health records or medical records you know of, add that to your resume, including Microsoft Office. And your hours are from on the weekdays and between 8 a.m. and 6 p.m. in the patient's time zone. And Cardinal Health is hiring a nurse, individualized care, access, and patient support. This is full-time. This job requires 2 to 4 years experience. RN license required. A BSN is preferred. Previous medical experience preferred, not required. And Microsoft Office to your resume. And you'll work on the weekdays from 8 a.m. to 5 p.m. Central Standard Time. All U.S. residents are eligible to apply for this position. But dial-up, satellite, Wi-Fi, cellular connections are not acceptable. And the salary is $67,500 to $101,220. I also want to add that make sure you finesse your resume to the job description. Whatever you see in the description of this job, you finesse the resume to that description. So whatever you do at the bedside, if the description mentions something being similar to the bedside, you make sure you finesse the resume for that remote position. And also, I suggest that you have different resumes for different positions. If you have a resume for case management / care management, put that in one folder, but make sure you just name it as your name. Because there's so many different types of case management / care management positions and names to them. that you don't want to get confused. So I just say keep it as your name, and then put it in a folder that you'll apply for case management or care management job for that resume. And then a different folder for, let's say, utilization review or clinical review or utilization management. You make sure you have a resume for that job description. That way you can keep all of your resumes in their own little spots, their own little folders, but it's organized. And make sure you focus on three things: what you did, why it's important, and how it relates to the job that you want.